Good morning, or actually good afternoon. Some of us have still not eaten lunch yet, so we're still in the morning, apparently. Shelter outbreak response for the LVT. And the reason this is important for veterinary technicians is the same reason that dermatology is important for veterinary technicians if you were here for the first hour today. It's because you guys are the front line of disease management and prevention in the shelter. So most of the time there isn't a veterinarian that's just lurking around the intake desk waiting for an animal to come and look at it and then identify something that may be potentially contagious and potentially contagious not only to the animals of that species but to other species, including people. But the LVTs are. And the the intake staff are as well. And so as intake staff and as veterinary technicians working in shelters, you guys are the ones that are going to be saving everybody from a lot of hassle when you recognize that certain diseases are happening and you take the right actions when you recognize that certain things are happening. So thank you in advance for helping us not spread disease throughout the shelter. This is my present to you for today. No, just kidding. I'm not getting anybody kittens. So what is an outbreak? When we say that we're going to control outbreaks and we're going to manage outbreaks, what are we talking about? Just shout out answers. This is a participatory lecture. Sure, more than one animal is affected. Yes, that has to happen for an outbreak. What else? Well, that can contribute to an outbreak, but what is an outbreak? If I say there's an outbreak of X disease in a shelter, what is happening in that shelter? Spreading around, right. So that's kind of the key point, is that these diseases are diseases that are contagious from one animal to another. You can have situations where multiple animals are affected that are not outbreaks. For example, if you use too concentrated quaternary modium cleaners in your cat wards and everybody ends up with oral ulcers and sneezing, that's not a disease outbreak, that's a toxin exposure. It can look like a disease outbreak. Similarly, if you have panleukopenia running through a cat colony, it may look like all the animals are being poisoned, but actually it's an infectious disease. And so it can go both ways with those. That's our most common differential when people say, somebody poisoned my feral cat colony. Most of the time it's actually panleukopenia. So an outbreak has to have an increase in the number of animals that have a particular disease beyond the normal levels. So if you normally have 3 cats that have upper respiratory disease at any given time in your shelter, and suddenly your isolation ward has 15 cats in it, you may be experiencing an outbreak of upper respiratory infection. What types of diseases can have outbreaks? Ringworm, that's a good one. What else? Upper respiratory, yep. Parvo, kennel cough. Calicivirus, yep. HIV. HIV? I don't know about people. FIV, yes, for sure. That one is transmissible. We don't tend to see outbreaks of that one in particular. It's kind of complicated, but that is a transmissible disease, yes. CIV, so influenza virus for dogs, yes, and also for cats now, unfortunately. So how many cases is an increase? Well, more than normal, exactly. And so it depends on the disease. So if I have 3 cats that have upper respiratory disease and suddenly I have 15, I think I can make a pretty good argument that that's an increase. What if I go from 0 cases to 1 case? Well, if I have rabies, then that is actually maybe an outbreak of rabies because there are so many different things that happen with that one animal that is affected. So that one animal is way more than normal, right? What is the normal prevalence of a disease in your shelter population? So what is the normal level of percentage of animals that are affected? You may not know, like in your head, what number that is, but you may, if you work at a shelter long enough, have a fairly good idea, just sort of whether something is more than normal or whether something is less than normal. And if you get that gut feeling that something is maybe more than normal, like, really, another one of those? Didn't we just have one of those? That's when you should probably start investigating, right? Okay, so, this is supposed to be in succession as well, but how does an outbreak happen? Well, there's a couple different ways. One is that one animal comes into the shelter with an infectious disease, and then all of a sudden everybody's affected. So influenza is a really good example of this. If you get one dog with influenza that comes into an animal shelter, and that animal isn't isolated because you didn't know that they weren't coughing yet, they were shedding, but they didn't have any clinical signs, you may end up with a lot of infectious influenza in your kennels. Or you can have a few animals that come in. So if you have a litter of kittens that come in, and one of those litter goes in this cage, and one of the litter goes in that cage, and one of the litter goes in that cage, and all of a sudden you have ringworm, for example, in all of your cages. That's why. It's because number of animals came in, and they all had this disease, and now they're all spreading it throughout the shelter. And then the last one is that animals contract the disease in the shelter. We can't really do anything about those first two. Well, we can do a little bit, maybe about that second one, which is keeping animals that come in together and away from other animals in the shelter. But when animals are contracting new diseases in the shelter, that's when we really feel like this is our responsibility and there's something that we did wrong if this is what's happening. Upper respiratory gets a little tricky with this one because there's two ways that upper respiratory is, that we see cats that come up with upper respiratory in the shelter. So the first one is that the animal already is infected with herpes virus. They come in, they get stressed because, hey, guess what? They're in a shelter. And then they recrudesce with this symptoms of herpes virus that we all know so well. So the goopy eyes, the runny nose, the sneezing, the not eating necessarily, all of those things can happen. The cat didn't catch that disease from other animals in the shelter, but the cat is having that disease because of the way that it's kept in the shelter. The other way that you can get upper respiratory disease in the shelter is by catching it from another cat that's sneezing. Although most of the time with cats, the way that upper respiratory infections are spread is by fomite, not by aerosolization. So what I mean by that is I'm touching the cats, and then I'm touching the other cats, and that's how I'm spreading the disease from one to another. Cats, when they sneeze, they have teensy little noses, and they can only get those aerosol droplets about 3 feet before they fall. And then they're in the environment, and we clean the environment, and everything is fine. So it's not really the spread by the air. With dogs, it is. So that's something that we have to be worried about. If we have a huge kennel full of dogs, they can get their aerosol droplets about 20 feet. Big noses. So these are all different things that you should consider when you're looking at what this uptick in disease is in your shelter, why it might be happening. So outbreak characteristics. What determines the seriousness of an outbreak? How much should I care? If I have a little bit of a diarrhea virus that's going through the cats in my shelter and everybody is getting a little bit of diarrhea and then 2 days later they're fine, do I really care that much? Well, as long as that's the pattern that continues and everybody gets better and nobody needs any treatment, I might be very vigilant and monitoring everybody, but I'm not really going to do much beyond that. If I start seeing animals dying, if I start seeing everybody being infected, those are two things that I care very much about. So, say I have backing up, the severity of the disease and who's affected. The other part about that is it just that species that's affected? Or are the people at risk? Are the other species that are in the shelter at risk? So those make the disease a little bit more concerning to me than the diseases that are very particular to one specific species. So this is my illustration of saying that this dog is having neurological symptoms, right? So I'm going to go through this breakdown of what is going on with this dog. So I've got this dog, I've got neurological symptoms, he's got these tremors. He already looks kind of crazy. So this is one of my differentials anytime I see neurological disease in the shelter. How serious is this? It's pretty serious, right. It's pretty serious. I now have to make sure that the dog is safe, not going to bite anybody. Have to go back through history, figure out who he talked to, who he touched, who touched him, who brought him in, who all was in that household, all of those different things, because rabies is fatal and it's zoonotic. So the two worst things that you can get in a disease, right? Well, what if it's distemper? So, right, I care because I have a lot of other dogs, and I want to make sure that this dog is not going to pass his disease to anybody else in the shelter. And so it's serious. He could die, especially if he has neurological disease that's part of his distemper complex syndrome. But I, as a person, am not going to be affected. So it's a little bit better, maybe, than rabies. I mean, depends on your sort of scale. What if he has a fungal encephalitis? What if he's from Arizona and he has coccidiomycosis in his brain? It's infectious. He got it from the environment. It's an infectious disease. Is he going to give it to anybody else? No. Is he going to give it to me? Is he going to die? He could. Yeah, he could die. Yeah. So that I'm concerned about it for his sake as one animal, but not necessarily as a population. What about rat poison? Not contagious. He could die. But it might be something that's in the environment that other animals may be also investigating, maybe touching, maybe eating. And so I care about where he got it from, potentially, but he's the only one that's going to be infected. And I'm probably, if I can nurse him through his symptoms, he's going to survive, unlike the dog with the fungal infection. What about cerebellar hypoplasia? What if he's shaking because his cerebellum didn't develop properly, because his mother got parvovirus when he was in his mother's womb? Not contagious, not going to spread, he's only going to get better. So that's fine. So this is why it matters to figure out why he's doing what he's doing. Because each one of these different diseases has a different profile and has a different risk for you as a shelter and for him as an individual dog, and for me as somebody who's touching him and working him up. So, and how contagious the disease is. So that's something else that we talked about a little bit here. Is the disease vaccine preventable? That's something I really care about, because if it is vaccine preventable, my population should be protected as long as they're vaccinated. Why wasn't he vaccinated? Well, maybe he came in with it. That's not my fault. That's something I'm just going to have to deal with. What if he got it in my shelter? Now we have a problem, and I have to figure out where that problem is. What if it's airborne? Now I have to worry about all the rest of my population, versus if it's just fomites, I might have protected him by wearing different gloves with different animals as I'm going through the shelter. Is it easy to disinfect? So can I just use my regular Wissy Wash or Kennel Sol or whatever it is that I use to clean my shelter and be fairly confident that even if he has this disease, I have already cleaned up after him? Or is this something I'm going to have to buy something special for or take special actions to disinfect? And then biosecurity. Wear gloves. Wash your hands. That already gets in the way of a lot of transmission of diseases from the animals to you. Hand sanitizer works pretty well. Yep. Mm-hmm. Gloves. Gloves are great for that sort of thing. Also, what Dr. Araceli said earlier today, don't eat poop. That's the other one. The big three public health things. Right. So when we talk about risk, one of the ways that we talk about it is this, how much of a hazard something is, and that's the severity of the problem times the probability that that problem will actually occur. So if you have rabies, the severity of the problem is so big that it doesn't matter that the probability of it occurring is actually fairly small. We care a lot about rabies. But if we have rat poison, it's not that common. It is severe for that one dog, but it's not severe for the shelter population as a whole, and it's not severe to me as a person. And so maybe that sort of the concern that I feel for an animal individually is high, but the concern that I feel for the shelter as an outbreak management situation is basically zero, unless they picked up that rat poison in the shelter somewhere. How do outbreaks happen in shelters? Just shout. This is where you shout things out. So not washing hands. I already said that one. Touching animals. Excellent. Not cleaning kennels properly. Not cleaning anything properly. What else? No PPE. Sorry? Not wearing PPE. Excellent. What else?
Not putting animals in isolation when they come in.
Excellent. So not isolating sick animals. Great. Anything else?
The environment itself.
Yeah, the environment can be contaminated. Excellent. So I'm I can't control the order that these come in. So these are things that I think of. So mixing populations, allowing animal contact, taking in sick animals, having small cages, having too many cats, having not enough time, not enough space, overcrowding, not recognizing sick animals, not cleaning properly. Those are probably the biggest three things. Mixing sick and healthy animals. And lastly, and of course, our favorite thing to talk about in the shelter is stress, because stress decreases the immunity of the particular animal, so then they are more susceptible to disease. Have you guys seen this triangle before? Every time you get a lecture by somebody who's in public health or epidemiology, you get to see this triangle. It's a very nice triangle. It's got 3 parts, like every triangle. It's got the environment. So if you're not cleaning properly, if there's a lot of disease in the environment, if there's too many animals that are shedding a lot of things into the environment, that can play a large role in disease accumulation. The agent, so if I have a rabies virus, what are the characteristics of that virus that make it so that it can get into another animal, or maybe not get into another animal? right? So those particular characteristics, and then there's the host, which is the animal itself, and that's where stress comes in. And so some of these things in the shelter I can modify, some of them I can't. So I can't really do much about the agent. I can't really take that virus and then maybe genetically modify it so it's not as contagious as it would be if I didn't mess with it. I can't really do that. But I can modify the environment by making it a clean environment, by making it a less stressful environment, by making it maybe larger rooms for the cats so they don't get upper respiratory, or maybe more enriched rooms for the dogs so they don't get kennel cough. And I can modify the host. So I can make sure he's vaccinated. I can make sure he's dewormed. I can set him up for having good immune responses to the things that he's going to encounter that I can't control. So this triangle is important. So prevention is also very, very dear to my heart. That's my preventive medicine degree that I have. So what you want to do is minimize the probability of acquiring disease. And this is what we do on a daily basis at the shelter. When animals are not sick, we are trying to prevent them from getting sick. And the goal is to get them through this sheltering process in as short a time as possible and as healthy as possible the whole way through, so that they can get through and get out on the other side and be a successful dog or cat or whatever job they have in life for the people that adopt them. And so boosting that individual resistance to disease and minimizing the exposure to pathogens is really key. And there's 7 basic ways of doing that: by vaccinating them on intake, by separating them by species and by age group, by isolating the animals that are ill, by treating any pre-existing conditions that come in, by effective cleaning and sanitation, by using appropriate housing for that species and that age group, and by giving them enrichment so that they can have mental stimulation and sort of calm and quiet when they need it. They can hide if they need it. They can have a sense of control over their environment. And this is how you avoid an outbreak. Basically, pure and simple. But again, there's that cat that walks through the door that's shedding things that we don't know that they're shedding things because they're doing it before they have any clinical signs. And then sometimes we have to mop up. So here's a scenario. This is my excuse for finding all these pictures of sneezing cats. I love pictures of sneezing cats. They're so, they manage to be static and dynamic at the same time. You just can't look at that picture and think that it's just sitting still. Everybody sees this cat closing his mouth and snot going everywhere. I think it's fantastic. So you've got 5 cats on your adoption floor that are suddenly sneezing. Ralph here was the first one to start having a runny nose, and he noticed this on Friday evening. It's 30 minutes before the shelter opens on Monday morning now. You've got 5 cats. 2 adult cats and 2 kittens are having ocular and nasal discharge. So that's right now. What you don't know is that in 2 more days, 3 more cats are going to get sick. Is this an outbreak? Yeah. Well, so it depends. What is the normal level of cats sneezing on your adoption floor? Should be none. So if it's none, if it's what it should be, if it's none, then yes, this is an outbreak. So what do you do? Yeah, I'm hearing fantastic suggestions all over the place. These are all the steps to responding to an outbreak. And they can happen in pretty much any order. So I'm not listing them by number. I'm just going through them because I have to go through them one at a time because I can't talk about them all at once. It gets very confusing. But so yes, to all of the different things that you suggested. Have you guys seen this kind of graph before? This is an epidemic curve. So what this is saying, I do think I have a pointer thing here. Oh, look at that. Okay, so this is the number of new cases. So if one case here, this cat is sneezing, he continues to sneeze. If he continues to sneeze, we don't count him anymore. We just count the next cat that starts to sneeze and the next cat that starts to sneeze. And so this is the time that the index case, so that's Ralph, is here, and he is shedding into the environment, but he doesn't have any symptoms yet, and so you don't see that until here. And now he's got clinical signs, and then this guy's got clinical signs, and this guy's got clinical signs. This is how long it takes for somebody to get the disease if they are now exposed to it. So this is your incubation period, which is important. It will come up later. And then this is time running this direction. So everybody gets sick, and then animals stop getting sick at that same rate. So this is still new animals getting sick, but it's not as many new animals getting sick all at once as there are right here. Does that kind of make sense? Okay. So, more sneezing cats. So we're recognizing that there is an outbreak. So you guys already did that. You did that because you said, we know that there should not be any cats sneezing on the adoption floor, and now we have 5 cats, and then in 3 days we're going to have 7 cats sneezing on the adoption floor. So that's the recognition part. Is this an outbreak, or is this normal shelter cat upper respiratory for your shelter? It's an outbreak. So that's good, because this is a lecture on outbreaks, and if it's not an outbreak, then I need to talk about something else. So next, how many URI cases do you normally have on your adoption floor? What if this is in your isolation ward? How many upper respiratory cases do you normally have in your isolation ward? Yeah, depends on your shelter. It depends on how many cats you take in a year. So these are all things that you will have to specifically define for yourselves. And it's good to have sort of a running total, so you can then look back and say, oh, well, you know, in December last year we had 2 cats in isolation. December this year we have 12 cats in isolation. Well, that's different. That's more. So we should be concerned. So then the next one is identify and define the cases. So how can you tell if this cat is part of this outbreak, or if maybe he came into the shelter and he was already sick? So you have to come up with what we call a case definition. And so that is saying all of the cats that have these symptoms, we're going to say, because we don't know any better and we're concerned about it, that they are part of this outbreak. So we're going to sort the cats into you have upper respiratory, you don't have upper respiratory. And we're going to say that sneezing and maybe ocular discharge equals you are in this group of affected cats, and we're going to put you all together. Now, maybe they have different upper respiratory infections. Maybe they have different bugs. Maybe one of them has caleci and one of them has herpes virus. We don't know that. But that's okay for right now, because right now we're just trying to identify and define the cases. If you have 5 cats and kittens having ocular discharge and sneezing and a runny nose, so that means that we've got 5 cats that we're going to say meet this case definition, and now we're going to treat them differently than the other cats in our shelter. So the next step is confirming the diagnosis. And again, this can happen kind of at any time, but if you are making some drastic interventions, like maybe euthanizing animals that have particular conditions, make sure you call a veterinarian, you call a diagnostic lab, you get a confirmation of the disease that you think you're euthanizing for. Because there have been shelters that think they're having a December outbreak and euthanize a whole bunch of dogs and then realize that it was their cleaning product that the dogs were licking and they didn't need to euthanize the animals. And I don't want that to happen to any of you guys. So if you need help, make sure you get an actual diagnosis before you do anything drastic. Now, if we're just isolating animals with upper respiratory infections, and we're putting them in a room until they're better, and then we're taking them back out again, that's not that bad, right? You can do that to a cat that doesn't have anything, and yeah, it's going to be a little bit more stressful, and they're going to take a longer time to get through the shelter and out to adoption, but the consequences are a little bit less grave, right? So for right now, we're saying upper respiratory infection. How important is it for me to get a confirmed diagnosis for upper respiratory disease in these cats? Well, right, so you have to know how to treat them. But what if it's exactly like all the other upper respiratory infections that I always see, and I have a protocol for treating them? Do I really need that? Is anything bad going to happen to them if I don't have a diagnosis in this particular case? No. No. I could be missing something else. There's always that chance. If I start my treatment protocol and something funny happens and they're not responding the way that they should be, I can always try to get a diagnosis then as well. So this can happen at any point, but if you're going to do something drastic, make sure it happens before that drastic event. Moving animals to isolation doesn't count. Okay? Different diagnostics that you could do if you wanted to do diagnostics for upper respiratory. Clinical signs are my diagnostic of choice for upper respiratory. But you could also do a PCR. It's expensive. You can do virus isolation. You can do bacterial culture if you're worried about mycoplasma. That takes extra special culturing techniques. So it's not without consequences to culture and diagnose everybody, right? Because you have to pay for it. And your shelter maybe doesn't want to do that because you're now spending extra money on these cats because they have to stay longer. So that's how you'd have to stick up the swab up the nose and then send it off. So, and then how long does your diagnostic technique take? That's another thing to think about, because if you're kind of on the fence about whether you want to do this particular diagnostic or not, how how is it going to affect the population if you need to wait for those animals to stay that long to get that answer back? And then how are you going to explain it to the adopters later on if you get a positive? When are you done? When are you done treating? So these are all the things I think about when people ask me questions about outbreaks that they're having in their shelter. The next step, or another step, is to separate the affected animals. So this is where I try to explain to you the difference between an isolation and a quarantine. You guys know what the difference is? It's kind of written up there, actually.
Quarantine, you gotta gown up.
So the suggestion is quarantine, you have to gown up. I agree, but isolation, you also have to gown up. So isolation means that the animal is sick and is now being separated from the rest of the population. So those 5 cats that we talked about are going to go into upper respiratory isolation. They are separated from the rest of the population. They are only housed with animals that also have clinical signs for that same disease. Quarantine is for animals that are not sick yet, but are exposed to the animals that are sick and may become sick in the future. And if one of those quarantine animals becomes sick, generally the rest of those quarantine animals are now exposed to that animal, so then their quarantine time period starts over. The clock goes back to 0, and you have to keep waiting, whatever period that is. So quarantine, and this is one of the ways that I remember what it means, is a term that dates back to the bubonic plague in Italy. The quarantine stands for 40 giorno, which is the 40 days that people who were exposed to people who died of the plague had to wait before they were allowed out into society again. So 40 days, 40 giorno, is quarantine. Isolation is just isolate, so away, separated away from the rest of the population, if that helps. You're going to need to know these terms later because we have a great exercise for you guys. So here's another kitten that's trying to sneeze. If you don't separate the animals into isolation, then you're going to expose a lot more animals, and so then everybody ends up having to be in quarantine, depending on how that disease is spread. If you have one animal that spreads disease by aerosol route, you may end up having to quarantine that entire room of animals. So that's kind of how it works. If you have upper respiratory disease and it's a cat, and you don't have people touching each cat with the same gloves, then you might be able to just pull that cat out and not quarantine the rest, depending on your level of suspicion of how much exposure the animals in that room have had to the animal that was sick. All sounds fairly familiar? Okay, good. Great. Yeah. And then the other thing about isolation is that the isolation room now becomes a biosecurity issue for your shelter. And so you want to control the people that are going in and out of that room. Quarantine a little bit less so, but you need to be very vigilant and be monitoring those animals on a daily basis to see if they're developing the symptoms of the disease that you're concerned about. So isolation is sick. We've got 5 cats that we're going to put in there. We're going to control the access. We're going to give them some supportive care. We're going to maybe give them some doxycycline. And we're going to monitor them closely for response to treatment and normal course of disease, what we expect. So that guy gets to go in there. Doesn't get to be in that room anymore. And then in quarantine, if you have a group room and the cats are rubbing against each other, or if you have a lot of volunteers that don't wear gloves in between cats like we have, then you would want to quarantine the cats that are exposed in adoptions. And the quarantine can happen maybe in adoptions. For example, maybe you don't add any new cats to that population until you've waited for that quarantine period to be up. That's one way to do it. The other way is to remove all of those cats from the adoption floor and put them in somewhere else, if you have a somewhere else, and wait for that time period to be up for them to not have any disease, and then you can put them back on the adoption floor. The quarantine period that I keep talking about is 1 incubation period. So remember on that graph when I said it takes this long for if you're exposed to when you develop the disease? So we've been studying these diseases a lot. In the literature, we have a lot of estimates about what you should expect in terms of when you get a disease when you were exposed to it. So if I expose an animal to parvovirus, I know I can expect that that next puppy that I expose is going to break with disease anywhere between 3 and 10 days that disease was exposed. So 3 days later to 10 days later. Now, there are some dogs that don't break till 14 days later. So my advice then, because I'm very concerned about parvovirus, because the risk there, the hazard equals death, I want to make sure we're waiting that full 14 days before I let that second puppy out of quarantine. Does that make sense? Yeah, okay, great. So, and then if you're in quarantine and there's one animal in there that becomes sick, you start that clock over again. So if you have a litter of puppies and one of them becomes sick, you take that puppy out, you put that puppy in isolation, the rest of those quarantine puppies now wait for another 14 days. That kind of sucks when that happens. So, and then those everybody, the isolated animals and the quarantine animals all get very closely monitored. So the next step here is the disinfect, the mitigate, the redirect step. So this is when you do your great shuffle and you move animals around the shelter and you maybe create a different pathway for animals coming into your shelter so they're not exposed, and making sure that you are doing the right type of cleaning for the right type of pathogen that you suspect. So if you've got parvovirus, you're not using Parvusol to kill it because it doesn't, even though the name is the same. And so this is where you want to do some research. This is where you talk to the veterinarian. This is where you look in the textbooks. This is where you figure out, if it's this disease, what do I need to use to kill it? How long does it take to incubate? What is the transmission like? How do the animals become exposed? And how can I avoid that with the animals that are coming into the shelter? Do I need to stop animals from coming into the shelter? Or can I recommend that they go to a different shelter down the road? And if I have animals in my adoption area, what do I have to do about those? Can I get them out? And then maybe close adoptions until everybody else is healthy enough to be adopted. So this is the step where you do all that kind of analysis. And it really, really depends on what the disease is that you're dealing with. So if it's upper respiratory, what are some cleaning compounds that I can use to kill the upper respiratory viruses? Bleach, sure, yeah. Excel, yeah, what else? Rescue, that's Excel, yep. Yep, anything else? What if it's herpes virus? Trifectant works. What else? Anything, really, anything. This is not a hard virus to kill. Any sort of disinfectant that you have, even the Kennel Sol, even the Parvusol, all of your quaternary ammonium products, all of those guys are going to kill herpes. If it's calicivirus, then we have to stick with the rescues and the trifectants and the bleaches. But if it's herpes, it's very easy to kill. And then one of the things that can happen if you don't use the right disinfectant, not only do you not clean up the disease from the area where it's most concentrated, but you can end up spreading it to other parts of the shelter on your rags that you're using in those affected rooms. So know what your disinfectants kill, know when you have to pull out something special. There's a lot of resources out there for you to find that information out. So the answer to what cleaning compound kills upper respiratory viruses, herpes is most things, calici is bleach, trifectant, Excel/rescue, they keep changing the name. What about bacteria? The answer is most things. When I say most things, I mean you don't have to really worry about it. Whatever you're using probably is fine. And then how is upper respiratory spread? We talked about this a little bit. So fomites. So bowls, litter pans, hands, stethoscopes, swabs, thermometers, anything that you touch an animal with can then spread the disease to the next animal if you don't clean it in between. But it's easy to kill. It's easy to clean. So that shouldn't be too much of a problem. Yes. Okay. So in this step also, this is where we might want to create a clean break in the shelter. Do you guys know what I mean by clean break? So you have a population of animals in your shelter. The way that animals come into your shelter usually, depending on your shelter, is one at a time. They come in, and then eventually they get mixed in with the rest of the population, whether that's in a solo cage by themselves, or maybe they'll be there for a little while and they'll get put into a group room. But you have all this huge population. And then the way the animals leave is one at a time, kind of in a random order, depending on how cute and fuzzy they are and how many problems they have and whether they're old. They will leave one at a time out the front door. In large animal operations, most of the time it's called an all-in, all-out situation, where you have a bunch of animals come in all at once. They're only ever exposed to those animals in their particular group, and then they all leave at the same time, usually to slaughter or maybe a feedlot or something like that. We don't do that in shelters. So we have a lot of mixing in our population. But with a clean break, what we're trying to do is make the animals that are currently in the shelter a cohort of sick animals or isolated animals or quarantine animals. And then we're going to make a separate group of animals that are coming in now that are not going to be exposed in any way to the animals we already have in the shelter. Does that make sense? So instead of maybe coming in and getting put into the cat room with all the other cats, they come in and they get put in the mobile unit without any other cats. So they're not exposed to whatever the cats have. Or maybe instead of coming in and going into the exam room like they would normally come in to get their vaccines, maybe they come around back, they get vaccinated in the parking lot, and then they get into the foster home's car, and then they leave the shelter. So they never get exposed to whatever is in the exam room or in the kennels or anywhere else. For example, if you're having a distemper or parvo outbreak. So there are certain diseases where this makes a lot of sense, and there are certain diseases where this doesn't make a lot of sense. So creating a clean break with upper respiratory infection in the shelter, since all of the cats that are coming in, 75 to 80% of them already have herpes in them, there really isn't much point in doing that, right? There's a lot of point in making sure that they aren't stressed in the shelter so they don't then recrudesce. But if you have parvo outbreak and you can redirect all of the dogs away from the dogs that you currently have until that quarantine period is up, you're going to prevent any of those incoming animals from getting whatever the current animals have. And then when that quarantine period is up, then you maybe can go back to normal operations. Although I would say there's probably a lot that you want to be changing about your intake protocol if you ended up with an outbreak in the first place, right? So incoming animals have no access to sick animals. Sick animals are kept very separate until they're adopted out. And outgoing animals continue to leave as fast as possible in whatever way, whether that's sending them out on transport to other shelters, whether that's adoption, events, whatever it is that you guys want to do to get them out. The next step in the disinfect, mitigate, redirect process is figuring out what the source of the infection was and what that prevention gap was. Because if you're having transmission within the shelter, we messed up somewhere. And so trying to track that down is very important. With certain diseases, vaccination on intake is the problem. It's not happening correctly. Whether it's you're not vaccinating animals that have like a little bit of a cold when they come in because you're worried that they're sick, or whether it's not vaccinating puppies and kittens because you're worried that they are too small, or maybe it's mixing up your vaccines and leaving them on the counter for a day before you use them. Or maybe it's when the shipment of vaccines comes in, you don't put it in the refrigerator, you leave it out. Right? So all of these different things can happen, and it can lead to infectious disease outbreaks by diseases that are preventable by vaccines. So, vaccinate. And then increasing outgoing numbers helps quite a lot in an outbreak situation if you can tell which animals are healthy and which animals are sick. So if you can get the healthy ones out, that gives your staff more time to deal with the sick ones. And if you can reduce the number of animals you have in your population any sort of way, that's great. That gives you the time and the bandwidth to actually deal with this problem. So, and finally, communication. Communication is really, really, really important. Isn't this a great picture? I love this picture. So communication happens at every one of these other steps. So when you're trying to figure out if an outbreak is happening, you're communicating with everybody in your shelter, whether it's with signs, whether it's a whiteboard, whether it's texting people that something is happening. Especially the managers, especially your director, especially your veterinarian, all need to know that something is happening and that you think you might be worried that something might be going on. When you're identifying and defining the cases, this is a group effort amongst everybody who's working in your shelter to pick out the cats that seem to be having the symptoms that you're looking for. When you're trying to confirm your diagnosis, everybody needs to be on the same page with this. So when you get that PCR back and it says herpes virus, then you can tell everybody, oh, this is herpes virus. So now everybody knows what type of biosecurity to use, what type of cleaner to use, whether you should be worried about cats that are getting newly infected or recrudescing, all of these types of things. Communication is part of the separating the animals because everybody needs to know that this room is different now. This room is now for the quarantine, and this room is different. This room is now for the isolation. Or maybe it's always isolation, but now you just happen to have a lot more animals in there. And then communication is really important in the disinfection and the mitigation and the redirection, because how are you supposed to figure out what went wrong with your process if you aren't talking to the people who are actually integral to that process? So, and then communicating not only within the shelter, maybe with adopters as well, maybe with newspapers as well, like, hey, look, we're having this huge problem at this shelter. Come and adopt the healthy animals so we can spend time with the sick ones. That's fine. Or maybe it's a public health announcement, like, we're having a ringworm problem in this shelter. We understand that this is a problem. If you would like to help us out, we could really use your help right now. Come and give us bleach. Come and give us paper towels. Come and give us gloves. All these things can be very helpful for you to manage this outbreak. And then back communication with people who dropped off the animals in case they didn't know that their animal was sick is also really important. So you get a litter of ringworm kittens in. The person who found those kittens didn't know that they have ringworm. Maybe they were like going like this with the kittens. It would probably be a good idea to give them a call and say, hey, just so you know, you might want to get yourself checked out. So I can't say enough about communication. Lack of communication prevents outbreak response from actually being successful a lot of the time. So signage, open communication, all that stuff. So also PPE. And this is an example of a sign. It says, for your health and safety, it is always wise to wash your hands with soap and water after touching animals or before eating. Please use the wash stations conveniently located in the children's zoo or the restrooms. When I hear children's zoo, I think of like all these kids that are in cages that you get to go see. Like, I was like, what? Yeah, okay. So when is the outbreak over? When are we done? This is really hard and it's stressful and I want to be done with this. Well, so there's a couple of different ways that the outbreak is done. So outbreak can be done for the individual animal, and that's done when the animal is no longer having clinical signs. Look, I don't have any lesions anymore. My hair has grown back. I'm good. I don't need ringworm treatment anymore. Or maybe the animal no longer requires supportive care with parvo. They're still shedding the parvo. Maybe I still have some diarrhea because the parvo cut off all of my villi on my intestines, but I don't need fluids anymore. I'm eating fine on my own. I'm doing good. So that animal is fine, but they're still in isolation because they're still infectious, right? When is isolation over? Isolation is over when the animal is no longer shedding infectious organisms, or at least is shedding them at such a low level that it's not really a concern with the right environment and host and other interventions. So if that puppy then, the parvo puppy then tests negative on a SNAP test and gets a bath about a week after the last clinical signs that I saw, I feel pretty good that that puppy is no longer shedding. And I can put that puppy out into the regular population, get him spayed and neutered, and get him, or him neutered, and get him adopted out, right? When is quarantine over? We talked about this. What was the quarantine period? 14 days. Well, for parvo, it's 14 days. Yeah, 14 days for parvo. It is the incubation period of your disease. So however long it takes for that disease to pass from one animal to another, that's how long quarantine is. And there's a range of times. Always go with the longer range, because you never know. That animal may be kind of healthy, and it may take them longer to get that disease, right? And then there's the outbreak. When is the outbreak over? Well, what we like to say in the industry is about 2 incubation periods. So you can relax and say, oh, I think we're done with this. If it's been, now, if it's parvo, right, 28 days since the last case that you saw. So that's the answer. If it's upper respiratory, if you don't have any clinical signs, now, you're probably fine. You might be shedding a little bit of virus, but it's probably not that significant, and probably all the other cats are infected anyway, so you can probably move out of isolation. Does that make sense? So the same time the clinical signs are done, you can move out of isolation. When is upper respiratory quarantine done? Do you guys know what the incubation period is for herpes virus? If you want to get a new infection of it, it's about 5 to 7 days. So it's pretty short. So quarantine then would be 5 to 7 days. 7 days because I'm going with the outside one, right? So as soon as 7 days are up and no more cats and adoptions are sneezing, I'm good with the quarantine. I can start adopting these animals out. And then my outbreak is over. 14 days. Perfect. Nice. Good math. Good job. So 2 incubation periods have passed. No new cases. So we're good. Now herpes, of course, being tricky because that healthy cat over there still has herpes. He just hasn't broken with it yet because we didn't stress him out enough, which is a good thing. So if you need help, if you think you're experiencing an outbreak, don't feel like you're alone, because you're not. So these 2 textbooks both have very nice chapters about outbreaks. This book here in particular, every single thing that you want to know about these particular diseases it has. So it has the incubation periods, it has what cleaners you need to use, it has how it's transmitted, how it's shed, when the animals are done shedding. All of that information is in this book. We also do consultations here at Cornell, Maddie's shelter medicine program. So if you have concerns, if you're having an outbreak, send us an email, give us a call. We respond pretty quickly if somebody says, outbreak. We're like, oh, shoot, better respond. If you ask us about what should I use to bathe my dog, it might take a few days or a week for us to get back to you. But the outbreaks, we respond right away. Maddie's Fund has a lot of educational resources on their website, so please go there and take a look at it. And then the ASPCA Pro has a lot of resources on their website as well. Yes. Okay, cool. Excellent. Thank you very much.